Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 043. On examination, the patient presents with hirsutism, moon-shaped face, stretch marks on the abdomen. BP is 190/100ths of a millimeter Hg, blood glucose is 17.6 mmol. What pathology is such clinical presentation? Characteristic of A. Hyperfunction of the insular apparatus. B. Hypothyroidism. C. Adrenocortical hyperfunction. D. Gonadal hypofunction. E. Hyperthyroidism. Adrenal cortex produces several hormones, which include aldosterone, a mineralocorticoid, cortisol, a glucocorticoid, and androgens and estrogen, sex hormones. Hirsutism is a condition of unwanted, male pattern hair growth in women. It often arises from excess male hormones, androgens, primarily testosterone, which are synthesized in the zona reticularis. It can be caused by polycystic ovary syndrome, Cushing syndrome, congenital adrenal hyperplasia, etc. Moon-shaped face is one of the characteristics of Cushing syndrome, hypercortisolism, caused by excessive cortisol, which is synthesized in the zona fasciculata. High levels of cortisol result in a redistribution of fat, especially to the chest and stomach, along with a rounding of the face. A blood sugar level less than 140 mg per deciliter, 7.8 mmol, is normal. A reading of more than 200 mg per deciliter, 11.1 mmol, after 2 hours indicates diabetes. A reading between 140 and 199 mg per deciliter, 7.8 mmol, and 11.0 mmol, indicates prediabetes. Elevated cortisol over a long term, the body consistently produces glucose that leads to increased blood sugar levels. This mechanism can increase the risk for type 2 diabetes, since the principal function of cortisol is to thwart the effect of insulin, essentially rendering the cells insulin resistant. The body remains in a general insulin-resistant state when cortisol levels are chronically elevated. Over time, the pancreas struggles to keep up with the high demand for insulin. Glucose levels in the blood remain high, the cells cannot get the sugar they need, and the cycle continues. The answer is C. Adrenocortical hyperfunction.